Good morning and welcome to True Hunt channel. Today we have got Dr. Ashok Rattan with us, and as you know that he is an ex-director of laboratories with WHO in the Caribbean, and as an ex-AIIMS faculty, and today he's as a director also with one of the path labs serving Pan India. Sir, welcome to True Hunt channel. Sir, my first question, as 100 crore of vaccination has been done, jiski charcha all over hai, sir. Sir, in this scenario, I would like to ask you that what is the necessity for a booster dose? What is your say on this, sir? Please.
Good. I think we must first congratulate the scientists and the administrators for making sure that in such a short time, 100 crore people have been vaccinated. At least one vaccination has been given, one dose has been given, but the evidence indicates that at least 2 doses are required for some certain amount of protection. This protection is not 100%. And it has been seen that young persons respond very well to the vaccine and produce neutralizing antibodies.
Right.
But those who are old, above 60 years of age, or have comorbidities, or are on immunosuppressive drugs, they do not produce antibodies by the first dose, or they produce very little antibodies. And by the second dose also, they do not produce antibodies.
Right.
So those who do not produce neutralizing antibodies would require a third dose, as this is extension of the vaccination. A booster dose could be either the same, or, as you know, the virus has changed from the previous Wuhan virus. It then became D614G mutation, which occurred in 2020. And now Delta variant. This Delta variant is more transmissible, as well as it escapes the immunity to a certain extent. So if the booster dose is with Delta variant, then protection will be better. But there is evidence in Qatar and in Israel that after 6 to 8 months of vaccination of the second dose, in some persons, there's been waning of immunity.
Right.
Therefore, a booster dose. And the same thing might occur. So I would suggest that we should limit booster dose to those who seriously require it and who might die if they get the infection.
Right.
That means persons over 60 years of age, persons on immunocompromised,
Right.
or cancer patients. They are the ones who would benefit maximum from a booster dose. Of course, as you know, monoclonal antibodies are available, and if they're given within 72 hours, they can save the person's life.
You're very right. But sir, I would like to ask you that obviously 100 crores of vaccination is a good landmark for especially a country which has got a huge population. And sir, do you think that in the coming months, everybody would be vaccinated, or still the vaccination, I'm talking about the second dose. So what is your take on that? Seeing the population of India, seeing the hurdles we have got, like in the remote areas, the reach out to the people, I'm talking about the hilly regions as well, the climatic conditions as well. So what is your say on that? We would be able to, in the coming months, we would be able to vaccinate each and every citizen of India, or still
there is that concept of herd immunity. The concept of herd immunity means that when sufficient persons of population is vaccinated,
okay,
or immunized, or has immunity, then the situation is not ripe for the virus to jump from one person to another person and to infect anybody. So our attempt is to have the largest coverage. Now,
Right.
how much percentage of population should be vaccinated depends upon the N naught. That means how much is the chance of the virus infecting others. And this seems to be changing with with this COVID vaccine, the virus. The SARS virus seems to be affecting more and more persons. That means the need for persons to have immunity keeps on increasing. Even if there are times when, for example, in Brazil, they had 75% exposure. 75% of the population was already having antibodies. And then a variant came and it caused a devastating outbreak. In India also, we are reaching in some localities, we are reaching over 70%. So one is that the vaccine protects if 2 doses are given.
Right.
If you have had 1 dose and you have a virus and viral infection and you recover, you still produce copious amount of antibodies.
Right, sir.
So maybe they do not need a 3rd dose.
Okay.
If they have produced a lot of antibodies. And that antibodies are protective.
Okay.
So the aim is that large number, as many persons as can complete their vaccination,
Right.
they should do it. Because this virus is behaving completely different than what we already knew. As you know, even mild infection can lead to post-COVID symptoms.
Okay.
So serious infection can cause death.
Okay.
But mild infection later on can cause prolongation of symptoms and post-COVID symptoms. So this is too dangerous a virus to ignore. And the sooner we have 2 doses, that is best. And a 3rd dose if required, not for everybody, but for those who have not been able to produce antibodies.
And the next, sir, how the world is seeing India now in terms of health infrastructure, health facilities, and in terms of treating a patient. Sir, as you might be aware, कि अभी तक भी people used to go abroad for some sort of their treatments at certain levels. So how, after fighting this pandemic, which was very deadly, how the world is seeing India in terms of healthcare?
See, I think India has had some confused decision making in the past, in the sense that normally government should focus on preventive medicine.
Right.
And private players should focus on tertiary care medicine. But once the funds are available, then tertiary care also should, government cannot take care of everything. Health is a state subject, that is one. And the main responsibility for health must lie with the patient. The person must own his own health. Then the infrastructure should be provided, which is either by the government, but government should focus on prevention and the first level of treatment. But tertiary care normally is best done in private. And since the GDP growth of India is not that much that every person can afford it, the best would be, as they've been starting, that there should be insurance, so that when you're healthy, you pay for your health, and when you're sick, then you don't have to pay and all. At this moment, I think 60% of all money goes out for treatment, goes out of patient's pocket. And that is why it leads to a lot of problem. So we have to relook at, there's a lot of population that is there, but primary healthcare should be provided free to everybody. Okay. I think there's also policies of giving diagnostics, but they must be made functional. And that is why the concept of private-public partnership is emerging more and more. I'll give you one example. There's the Jeet program. Jeet program consisted of uh, efforts for elimination of tuberculosis.
Right.
In the past, the government was focusing on government hospitals and the private players were ignored.
Right.
Then Global Fund was made available so that private practitioners who see the TB patients, sample could be picked up from them. The private players were very happy, private practitioners were very happy that their samples were being picked up. But when the samples will reach the government labs, they will not walk the extra mile. As a consequence, the results will come out in 5 days or 7 days or sometimes many weeks. And private practitioners are not used to this kind of lax services. And that's why they started getting annoyed. Then the Jeet group decided that they will rope in the private labs.
Right.
We give results the next day. So we did 18,000 tests. When the sample load increased, we increased our timing from 12 hours to 24 hours.
Right.
When it increased, because one machine can do 4 tests and it takes 2 hours. So if you have 16 samples, then you can handle. But if you have 100 samples, then even one machine can do running round the clock will handle 32. That means you will need more machines. So we bought more machines, got everything going. But our aim was that the next day the report should be there. So if you so that would mean that private players would have the flexibility and the desire to meet the turnaround time, while government works in its own rigid way. As a consequence, I feel the infrastructure should be created by the government, but the running of those infrastructure could be with public-private partnership. In partnership, we can provide much better service at much lower cost.
Sir, in this scenario, we have got people below poverty line also. Sir, what about their health care? After especially this COVID, because this COVID has hit each and everybody, irrespective of rich, poor, private, public, each and every person was affected. Sir, what about, what is your take on this? That what government can do rather than in this?
So it is that would mean the increased awareness.
Okay.
Because if a person is poor, it should be that means he cannot afford to lose his daily wages.
Exactly.
That would mean that the vaccine should be available where he works rather than he having to come and stand at the PHCs. And that is why I think this vaccine, initially there was hesitation because the vaccine could have caused anaphylaxis and we did not know how frequently it would be.
Right.
Because if anaphylaxis occurs in the field, that patient might die. And one death would lead to everybody avoiding the vaccination.
Right.
So initially it was suggested that it be done only in healthcare services. And after you take the vaccine, you sit there for half an hour so that if there was any side effect, it could be attended to there.
Right.
Now that 100 crore or more vaccines have been given and no serious untoward evidence event has occurred, now it is just like giving a tetanus toxoid vaccine. So it could be given to places where they work.
Sir, I would like to interrupt. You mean to say that for the below poverty line people, government should also take any initiatives for their health plan or health insurance stuff on very less economical price so that they can afford the what you call wellness at an initial stage, so that their immunity also is strong?
That's my impression that government, the Prime Minister has already started a scheme for 5 lakhs as the insurance coverage to all families below, all poor families.
Okay.
And along with that, we need to be patient centric. Normally in healthcare system, in India especially, the persons feel that they need to sit somewhere and patients need to line up and come. We do have ASHA workers who go house to house.
Okay.
So maybe, the patients during COVID have got used to staying at home, getting somebody come home, collect the sample, and digitally transfer the results. So this kind of benefit should continue and extend to as much as possible, so that instead of patients having to come to the hospitals, we need to have more and more substations and more enable and train
Right.
the ASHA workers more, so that besides taking samples, besides taking blood pressure, weight, height, etc., they could give injections. And if they are, since ASHA workers are going to from home to home,
Right.
they would be the ideal last mile reach to reach everybody, so
Right.
that everybody has access. Now, along access is not enough, because you have to break their barrier. I have maid servants at home, and though all of us got vaccinated earlier, the
Right.
maid servant was the last one to be vaccinated, and it took quite some convincing to tell them that yes, they would have a little bit of fever after the vaccination, but this will protect them better. And now I'm happy to report that both the maid servants have taken both the doses, so they're protected also.
This is, sir, an example, and I wish that everybody in their homes having maid servants or anybody related to them, so that they can advise for a vaccination, which is very essential at the moment. The more we are vaccinated, the more we are safe. We have talked about the how the world sees. So, what are the learnings?
The learnings are for the patient,
Yes.
for the lab, for the healthcare delivery, and
Right.
for the government.
Right.
So one for the patient is that mostly patients will be more aware of their own health. And I think they would like to retain the benefit of home delivery of services more and more, having their digital records. For the lab, there are going to be two kind of approaches.
Right.
As you've seen, many new players have jumped into, but they can be and the central labs are consolidating, so that smaller labs are having difficulty to meet the daily needs. So they're consolidating. And I think more and more standard operating procedures, accreditation would do well for the infrastructure. That is one. We should have more private-public partnerships
Right.
where the private players do the operations while the infrastructure is in the hands of the government. Then the government need to focus on surveillance to ensure so that we are forewarned and ready for anything that happens. Government has done very good steps of making most of the thing. Early on, nearly everything was imported. Even now in diagnostics, many of the kits are imported. But because now more than 3,000 labs can do RT-PCR, I hope that the new tests will be made available, so that these machines could be used for diagnosis of tuberculosis, for diagnosis of malaria, for diagnosis of typhoid, and for definitive diagnosis. When the diagnosis becomes definitive, treatment becomes easier. At this moment, treatment is like you're shooting arrows with your eyes closed. You don't know what you are aiming at. Sometimes the target is hit, but most time the antibiotics are useless. There is also another biomarker which has been identified that needs to be made cheaper, so that that can identify whether a person has bacterial infection or not.
Right. Sir, my last
And
line up. 100
yeah,
crores of vaccination. Very good. And everything is going till now well. Uh, And as you said, that it is a good landmark. Sir, seeing the healthcare system presently and what infrastructure and facilities we have got, and as I take your last point, which you have said that so that the other machines could be used for diagnosing or doing tests for tuberculosis and other kind of diseases. Sir, do you think that in this scenario, government needs to give an help to the present infrastructure? I'm talking about the private infrastructure as well, so that they can add up new machines and stuff for COVID or this kind of pandemic, as in 1 day or 1 year's time, no big infrastructure can turn their machinery equipments, because everybody has got certain limitations with their finances. Any sort of scheme from our channel you would like to highlight that government can do?
See, I think we should take a lead from what you see as the roadways. There were times when the roads were full of potholes and were narrow. Okay. Now you see highways spread all over India, and yes, that has changed the sea. That has made things easier to travel, and except when protesters are blocking it, you find that traveling is easier. Similarly, as I said, I keep advocating that health should be on a PPP model. Government should not run it alone, and private should not run it alone. We should run it responsibly, so that the cost is clear and the patient should be protected by universal insurance. If they have an insurance scheme, so they contribute even 1 rupee per day contribution of health to their health when they are working, so that when they are sick, they would not have to pay anything. Okay, so if yes, please, all three persons play their role, I think we would have a sea change in India.
Well said, sir. So this was Dr. Ashok Rattan, who was talking to us about the learnings for a new healthcare system. Thank you so much.